Hello everyone, my name is Dr. Drut. I'm orthodontist and I'm a clinical director of diamond braces. Up to this date, we successfully treated approximately 100,000 patients or even more with fixed appliances, braces, or we did approximately 8,000 patients with Invisalign. We don't have any financial interest in any of the companies, so if you're watching this video and your teeth are not straight, it will potentially save you thousands of dollars. So let's go over some of the differences. When you approach direct-to-consumer companies, you never see the doctor, obviously, and they claim that the doctor is remotely treating you and doing the ClinCheck, what they call, or engineering of the aligners. In reality, if you don't speak personally with a doctor who has experience in treating your particular case, it's gonna fail. Okay, it will not work. You gotta speak to the doctor, you have to know the doctor, you have to understand what they're doing and make sure the doctor is responsible for the outcome. Of course, you have to comply with the treatment, obviously. If you don't listen to the doctor's instructions, nothing is gonna work. But the doctor is responsible for the outcome and you have to help the doctor. If the case fails, it's a doctor's fault, okay? And as long as you follow the instructions. So that's important to understand the doctor. That's why the states have certain regulations that the doctor license displaced in the front of the office, so you know his or her license, who is treating you, okay, and why. That's the first reason when you go to the doctor directly. Now, second reason, plastic. Invisalign is the best company out there when it comes to clear plastic delivery, okay? And why? Because the plastic they look like a plastic, very similar, but in reality, Invisalign using smart truck plastic that has much better adaptability, flexibility, and overall experience in delivery. Other companies don't use the same plastic. That's why I always recommend Invisalign, not because I have any financial interest to that company, but because it delivers the results. Direct to consumers, they don't offer you attachments. What is an attachment really in the tooth? It's like, imagine a door that's tightly closed. No handle in the door. Can you open the door? It's difficult, if possible, right? With attachments, it's like a good handle, and you grab the handle and you open the door. That's what attachment does to the tooth. Without the attachment, it's not going to work, period. I'm gonna show you one patient that came into our office about 1.5 years ago, and it's one of the thousands of patients that I would like to share how we treat the typical case, really, typical patient, I would say. And she has severe, what's called malocclusion, problem with the bite, open bite, crowding in the lower, and she's an adult in her late 20s. So she had problems smiling and she had problems eating, and she wanted to improve her smile. Even though when you look at her picture, she has a nice smile, but when you look at close up, you can see how the teeth don't meet properly. So she came to a couple of places, and then she came to diamond braces, and we decided to treat her without surgery, without extractions of any teeth, with Invisalign. And you can see these pictures were taken in December, so we inserted the first tray in January of 2018, and now this is October of 2018, so it's about 9 months in treatment only. And that's the progress pictures, and you can see the lots of improvement before and after, only 9 months. It's amazing. And this is the final, and final is really perfect. It's about 1.5 years. It's May of 2019, and you can even look how her hair has changed as we progress. Look how she looks much more confident now. Her smile is much more confident. And let me explain in details how we did this. And this is her initial treatment planning. It's called ClinCheck. This software called ClinCheck that provided to the doctor by Invisalign company, and we have to manipulate this. Really, it's called ClinCheck engineering. So the doctor is an engineer who will engineer the treatment. In fact, all those attachments are individually placed based on the movement of the tooth in 6 planes of space. As you can see in this table, each tooth numbered, and we have 6 measurements in each tooth, and we have to really calculate each measurement, and then you can see how the teeth move and they close the bite, right? So this is her first 36 trays. Each tray we told her to wear for 1 week only, And then if you look at her, this is her initial, then we're gonna go to progress, ClinCheck. This is the progress that she came after 36 weeks. And we ordered 24 more trays to improve her bite even further. Again, you can see different attachments that we engineered and placed, and that's how it looks at the end. And if you look at this final results and compare it to the real ones, as you can see, it's really the same thing. So we, in about a year and a half, we established almost ideal, I would say, based on her age, of course, occlusion with the midlands aligned properly, with the bite is perfectly set, and with a happy client. Thank you very much for watching, and if any questions, make sure you visit your orthodontist.